A dental hygienist rocks, and City Dental Jamaica collaboration. There once was a time when people took very good care of their teeth. But everything changed when COVID-19 attacked. People began neglecting their teeth when it became mandatory to wear masks, not knowing the effects of such neglect. If you haven't been to the dentist since the COVID-19 pandemic, prepare for the unmasking. It is time. This is Oral Health Awareness.
Healthy Smiles Promotion, a City Dental and Dental Hygienist Rocks collaboration.
Let's talk teeth.
What are teeth? A tooth is a hard structure embedded in the jaws of the mouth that functions in chewing.
Let's check out the functions.
Functions of our teeth: breaking down food, shaping the face, word pronunciation, speaking. This dentition represents the teeth in your mouth. These are the types of teeth in your mouth. Incisors, canines, premolars, molars.
Let's take a closer look. Bad things that can happen to your teeth. Plaque on teeth. Calculus on teeth. Cavity. Gingivitis. Toothache. It is very important for you to take care of your teeth. Bad breath. Sensitive teeth. Tooth discoloration. The importance of cleaning your tongue, avoiding bad breath.
To clean the tongue, but most are flexible scrapers. As can be seen here, the area is scraped and all the bacteria and byproducts.
Brush your teeth with care. Do not forget that your gums are sensitive. Toothbrush abrasion, the damage and wear that is caused by brushing your teeth and gums too hard. It's usually visible near the gum line.
Let me introduce you to plaque, calculus, cavities, gum disease, and toothache. Plaque is a sticky, colorless film made of bacteria and the substances they secrete. Plaque develops quickly on the teeth after eating food, but it can be easily brushed off. If plaque is not removed, it mixes with minerals to become tartar, a harder substance. Tartar requires professional cleaning for removal. Tartar is also called calculus. Cavities are the tiny holes in the tooth. Cavities are caused by a combination of factors, including bacteria in your mouth, frequent snacking, sipping sugary drinks, and not cleaning your teeth well. Gingivitis is a common and mild form of gum disease that causes irritation, redness, and swelling of your gingiva, the part of your gum around the base of the tooth. A toothache is caused by the irritation of the nerve surrounding the root of a tooth. Tooth infection, decay, injuries, or loss of tooth are the most common cases of dental pain. Stop damaging your teeth.
Plaque is the term used for tooth deposits. Plaque causes caries and periodontitis. Plaque is a biofilm that is formed by bacteria on the teeth resulting from saliva and food scraps. Mature plaque is organized exactly like a small town. There are bacteria whose only specialization is sticking to the tooth, other bacteria that form tubes in which nutrients are transported, and yet other bacteria that dissolve the dental enamel and thus produce energy for the plaque, to specify just a few. By themselves, these bacteria are not harmful. The damage only occurs when they are organized in the form of plaque, or ultimately in the form of caries and/or periodontitis. Disease-causing plaque develops within 24 hours, so it's important to inhibit the formation of plaque, because it's the only way for your teeth to remain healthy. Plaque can be removed with a toothbrush, dental floss, and water pick.
Take a look inside your mouth at the big molar teeth in the back. You see those deep grooves on the tops and sides? That's one of the most common places for tooth decay or dental caries to begin. You can help prevent cavities from developing by brushing after meals and snacks at least twice daily for 2 full minutes. Try to cut back on sugary snacks, soda pop, and sports and energy drinks. Otherwise, what's going on in these teeth could happen to yours. If food deposits are allowed to stay in the pits and fissures of the teeth, bacterial acids and enzymes can dissolve away the enamel. Acids from food and drink can also directly dissolve enamel. Here's another place where bacterial plaque accumulates, on the sides of the teeth along the gums and between the teeth. That's why it's so important to brush the sides of our teeth as well as the tops, angling the bristle tips beneath the gums, and then flossing between the teeth every day to get rid of the fuzzy plaque. If it's allowed to remain between the teeth, you may develop cavities on the interproximal surfaces, which require the removal of more healthy tooth structure to fix. It's also where most gum disease begins.
Brushing your teeth.
Number 1. Remember to clean the difficult areas first. Your toothbrush is just a tool in your hands. It can only clean those teeth to which you guide it. Keep in mind that every tooth has several surface areas, a fact that is often easily forgotten. The longer you brush your teeth, the less motivation you have to keep going and to do well. Therefore, keep the easy parts, in effect the front teeth, until the very end. Begin with the inside surfaces in the lower and upper jaw. After that, move to the outside surfaces. Finally, brush the chewing surfaces and the anterior teeth. In the beginning, inflamed gums might bleed heavily. However, please continue to brush thoroughly anyway.
The tongue has a lot of surface area, with many tiny spaces. These spaces can be filled with bacteria that is present in the mouth. The bacteria produce toxins, the most common reason for halitosis, or bad breath. This is very easy to correct. There are many different tools that can be used to clean the tongue, but most are flexible scrapers. As can be seen here, the area is scraped, and all the bacteria and byproducts removed. Cleaning the tongue should be part of the daily routine.
Flossing 101.
Mend dental floss. Wind 18 inches of floss around the middle fingers of each hand, leaving about 5 inches between your hands. Pinch the floss between your thumbs and index fingers and leave about 1 inch in between to work with. Gently guide the floss down between the teeth using a side-to-side motion. Pull the floss tightly in a C shape around the side of the tooth and slide it under the gum line. Clean the surface of the tooth by using an up and down motion, not side to side, until the surface is clean. When all the plaque has been removed, you'll hear the floss start to squeak. Then pull the floss around the next tooth and repeat the process. Wind the floss to a fresh section and gradually work your way around your mouth, cleaning both sides of every tooth. If your gums are infected, they'll bleed when you floss, and that's to be expected if you are just beginning to floss. After a week or so of regular flossing, the bleeding should go away. Now you know why brushing your teeth is only half the battle. Most cavities and periodontal disease start between the teeth, where your toothbrush simply doesn't reach.
Dental health and nutrition.
No surprise that your diet also affects your dental health. Nutrients found in fruits, vegetables, legumes, and nuts improve your body's ability to fight bacteria and inflammation, helping to protect your teeth and gums. Some foods actually help defend against tooth decay in special ways. Recent studies have shown that fresh cranberries can help prevent bacteria from forming plaque. Calcium-fortified juices, milk, and other dairy products are rich in calcium and vitamin D, which promotes healthy teeth and bones and reduces the risk for tooth loss. Cheese unleashes a burst of calcium that mixes with plaque and sticks to your teeth. This protects your teeth from the acid that causes decay and helps rebuild tooth enamel on the spot. Crisp fruits and raw vegetables like apples, carrots, and celery help clean plaque from the teeth and freshen breath. You may already know that cavity-causing bacteria feed on the sugars in soda, chocolate milk, and candy. Sugar is converted to acid, which attacks tooth enamel and causes tooth decay. Did you also know that acidic foods and drinks such as carbonated beverages, citrus fruits and juices, wine, pickles, and honey can cause tooth enamel to wear away, making teeth sensitive, cracked, and discolored? A diet that promotes good oral health is not just about the foods you eat or avoid. When and how you eat them is equally important. Foods that take a long time to chew or that you hold in your mouth, such as cough drops, cause damage because they hold sugar against teeth longer than other foods. Instead of snacking on sugary, carbohydrate-rich, or acidic foods throughout the day, eat these foods just during meal times to minimize the amount of time your teeth are exposed to acid. If you don't have a toothbrush handy, chewing sugarless gum that contains xylitol can help reduce plaque and fight cavities. Chewing stimulates saliva, which helps keep teeth clean, while xylitol prevents the growth of bacteria that cause cavities. Following these good practices will help keep your teeth healthy for a lifetime.
Did you know that drinking water makes all the difference for your oral health? A bright smile makes everyone feel prettier. It increases self-esteem and also the sensation of cleanliness. Isn't it right? Water is important for our health and for the good functioning of the body, including the mouth. Did you know? Drinking water is essential for health and also to keep your smile perfect. Our saliva is made of 95% water, and the reason water is so essential for oral health. Also, did you know that saliva cleans the teeth and maintains the mouth pH? But if you don't drink enough water, what issues can appear? When you don't drink the ideal amount of water, you may have a dry mouth, troubles chewing, swallowing, and speaking, loss of taste, and oral diseases like cavities and gingivitis. Saliva also has an enzyme that aids in the digestion of certain foods, like the starchy ones, and a dry mouth hinders it. And if that wasn't enough, not drinking water may cause tooth decay. Did you know? Drinking water is essential for keeping your mouth ready to fight the things in it. Water helps with saliva production, which plays a role in neutralizing the acids that attack the tooth enamel and leave them more sensitive and decayed. Besides, a study published in the International Journal of Dental Hygiene also states that drinking water in the morning helps lessen bad breath. And according to this research, you can either drink water or just do a mouthwash to ensure that 60% of the harmful substances are eliminated. Isn't it incredible? Many things can help you drink more water throughout the day to ensure good oral health. As soon as you wake up, drink at least a glass of water to clean your body. During the day, take small sips of water whenever you can. Keep a water bottle with you and take it wherever you go. This way, you will always have water around, and it will be easier to get into the habit of drinking it.
The biting or grinding surface is not flat. There are elevations which are known as cusps, and there are depressions known as fossa. Between these cusps and fossae are fissures and pits. These pits and fissures are very thin. Food is most likely to be trapped in these pits and fissures. It becomes very difficult to clean these since a brush does not always reach it easily. Food being entrapped in these pits and fissures leads to breakdown of the enamel surface and spread of decay. The treatment involved at this stage is very simple and non-invasive. It involves using a pit and fissure sealant. A pit and fissure sealant can also be used as a preventive treatment to shallow the pits and fissures so as to prevent food harboring in them. The sealant forms a smooth, protective barrier by covering all the little grooves and dips in the surface of the tooth. Sealants are applied only on the back teeth, the molars and premolars. Your dentist will tell you which teeth should be sealed after they have examined them. Some teeth naturally have deep grooves which need to be sealed. Others with shallow grooves do not need sealing. This procedure is totally pain-free. The process is usually quick and straightforward, taking only a few minutes per tooth. The tooth is thoroughly cleaned and an acid etchant is applied to the grooves. This is then washed and the tooth is dried. This is followed by application of a special adhesive. The liquid sealant is then applied and allowed to set hard, usually by shining a bright light onto it. These pit and fissure sealants can last quite a few years. Regular checkups with your dentist can ensure that the seal is intact. Sealant is ideally applied as soon as a permanent tooth erupts in the oral cavity. The smooth sealed surface is now easier to clean with normal tooth brushing. Pit and fissure sealant can reduce the decay in the oral cavity and the number of fillings you may need.